Thursday, the 17th of November 2016 is World Prematurity Day, and the Ministry of Health, Wellness and the Environment, specifically the Neonatal Department at the Milton Cato Memorial Hospital, is participating in the international campaign to raise awareness of preterm birth. Prematurity is recognized worldwide as premature birth is a very serious health problem, hence the awareness campaign. Worldwide, 15 million babies are born preterm and more than 1 million die as a result. The rate of preterm birth is increasing, and yet the general public knows little about the prevention of preterm birth and the problems and risks involved in the development of a preterm infant. Preterm or premature birth, births before 37-week gestation, is the second leading cause of newborn death globally. Babies who survive an early birth often face the increased risk of health challenges such as breathing problems, cerebral palsy, intellectual disabilities, and many other hurdles. For many families, preterm birth brings with it neonatal or infant loss. So we want you to join the campaign to raise awareness of the issues these vulnerable newborns and their families face. The color purple is used to mark the day, and persons are asked to wear the color purple for preemies.
So this is World Prematurity Month, and pretty much the department will be hosting a week of activities to represent this. Can you talk to us a little bit about prematurity?
Well, thank you for asking me to speak about this. The neonatal intensive care currently is housing 5 premature babies. By the word prematurity, we mean any newborn who's born less than 37 weeks gestation, irrespective of the weight. So that is defined as a premature baby. And prematures are fragile. They can die easily. They have respiratory complications. Simply put, they are not ready to come out into the bad world. And if they do, then there is a long, torturous course of survival which they have to endure before they can go back to their parents. So, in order to safeguard this very vulnerable and special group of children, this year we've decided to highlight we decided to celebrate the lives of our premature babies, and also the babies that are there now and the babies that are demised. In every aspect, they have taught us something.
And why was the color purple chosen?
The color purple is not chosen by us. It is the color code. This is an international thing. There is a march of the dimes, and this is something that maybe it is a combination of the pink and the blues. So therefore they chose a neutral color, I'm not sure, but it has been there. I mean, it's celebrated internationally. Every year it usually falls, the World Prematurity Day usually falls between the 15th to 17th of November.
You're a consultant with responsibility for premature children. Everybody knows they're very close to your heart.
That is correct.
What does this day symbolize for you?
It symbolizes if I can get some time, and if I and the team can get some time in order to send out a little message to the mothers out there that it's not a death sentence again. And there was a time when there was a lot of brouhaha about a premature baby, and you knew that this baby is not going to survive. But a lot of babies have survived, and a lot haven't. And simply because they are so fragile, they pick up infections easily, they die of respiratory issues, they can bleed easily, and they have a lot of complications which a full-term baby might not have. So we thought that it might have been a good opportunity to empower, enlighten, and encourage others, because we cannot do it without them. They are the ones who have to be taught and encouraged how to look after these premature babies.
And what role can the society play in the process? Premature children are born into our families, into our communities, and what kind of support do you think?
The premature babies, as I've been telling you over a period of time, that they can suffer a lot of complications. And to name a few, they can have a retinopathy of prematurity, means they can very easily go blind. There are certain heart defects which might come along with it, but most importantly, and I think that one that really affects the family, the community, and the society as a whole is the developmental disability which a lot of prematures have to go through. The brains are small, they're immature, and therefore they can be damaged easily. They can undergo, there might be a variety of reasons why their brains can get damaged. It might be just a lot of the infection, it might be a lot of the oxygen therapy, it might be just multitude of reasons why this premature can undergo brain damage over a period of time, and it might show up. And we all know that it's very difficult to look forward to have a baby coming home, and then a baby comes home, and then by 4 to 6 months of age the signs of disability are obvious. That's tough. So and I think every lesson we have learned, we have to share it with them, that it is a possibility. It is a possibility that all these things might happen. But in spite of that, there are prematures who have made it, and they have led very good lives. We just have to make sure that we tell them.
Okay. You just state for the camera your name and what is your role here?
My name is Dr. People know me as B. I'm the Chief of Pediatrics at the Cato Memorial Hospital. I've been here for a while, and the neonatal intensive unit is very close to my heart, as most of the people critically ill children.
Thank you so much.
Thank you for having me.
So my name is Dr. Vanika Brown-Ferdinand. I'm a medical officer at the pediatric ward at Milton Cato Memorial Hospital. I specifically work in the neonatal intensive care unit, NICU, where we deal with babies that might have some life-threatening problems. In particular, premature babies, which are babies born less than 37 weeks. And this is Prematurity Awareness Month, so we are trying to get the word out about premature babies to the nation. So prematurity, as I said again, this is when your baby is born less than 37 weeks after conception. It is 37 weeks in the womb. So what happens when we have premature babies, their organs are not fully developed. So some babies might come out with problems breathing, as in they're breathing fast, as well as their brain isn't fully developed, so sometimes baby forgets to breathe basically. So we have to stimulate babies to get them breathing. The initial breathing fast phase, we usually give them extra oxygen, as well as some pressure to help babies breathe. It usually lasts up to a couple of days to a couple of weeks. So each baby is different. The smaller the baby is, the longer we tend to find them needing the extra support of the oxygen. As well, because their intestines aren't fully developed. Initially, some babies can't feed, or some babies start feed, but then we have to stop them, let their gut develop a little bit more, then start that feeds. Other problems that we might find are because they're small, they tend to be more infections. They get infections easier, and infections can be more severe. So usually we have, once there's any sign that baby has any sort of infection, baby started on antibiotics and kept a close eye on until whatever problem resolves. Other problems are because they're small as well, they can't control their sugars, so they have low sugars. So we usually have them on IV drips just to keep their sugars up, as well as feeding them. Other problems will be jaundice, which is yellowing of the skin. This is because the liver isn't fully developed yet to deal with bilirubin, which causes the jaundice in the skin. Usually for this we have a blue light that helps break down the jaundice under the skin, as well as IV fluids to keep the baby hydrated. There are also some that have anemia, because the bone marrow, which is where the blood is made, isn't fully developed again, so they don't produce enough red blood cells, so then they get low blood. So you usually have to give them packed red blood cells to help increase this number. So those are just some of the short-term complications that we face in our. Yeah, well, the success really depends on how the size of the baby and again how long the baby has been inside. The longer the baby has been inside and the bigger the baby, usually the better the outcome. So the success rate is a bit hard to.
Okay.
So, and the nurses play an intricate part in this as well. Whenever the mothers come, try to explain what's happening to the babies, the nurses would assist with feeding them. Sometimes we have to place tubes through the nose or through the mouth to the stomach to feed them initially because they don't have a suck reflex. So usually we get the mothers involved. The nurses play a really, really big role. They help them, show them how to actually do this by themselves so they're more involved in the care. They also show them how to change babies, how to be delicate with the babies as well. And even before discharge, we usually show them a video of how to do basic support just in case baby stops breathing or anything, how to try and get baby breathing and heart beating again. Yes, so some of the major complications are because they're on antibiotics. Some of the antibiotics may cause hearing problems. So some children might have hearing problems. The only thing is, here now we don't have any equipment to do hearing tests for the small babies, but once you're a young child, you can have hearing tests done. Another problem is because you have to give them extra oxygen, sometimes it causes extra blood vessels to form in the eyes that can cause blindness. So right now, within a month, we usually get the eye specialist to take a look at the eyes to try and prevent further damage of the eyes. And right now we're trying to use less concentrations of oxygen to try and prevent some of this as well. Again, because they're small, they have breathing problems, sometimes they don't have enough oxygen going to the brain. So then there's always the possibility of having some developmental problems. Other complications as well is sometimes they might get a bleed early on, which might also affect development later on in life. So usually for us, we usually follow up patients in clinic just to make sure that they're developing as they should. Okay, so for our premades, we usually make sure that they are at least back up to birth weight, as well as they're able to feed on. We try as much as possible to make sure they can feed on their own without that tube. So for the small baby, they tend to have longer stays because it takes a while for the baby to get that sucking reflex that I spoke about. So they usually go once they're able to take by mouth, they're comfortable with mommy understanding how to take care of a baby at home. So once babies are stable, as in they're not breathing too fast, usually allow the mommies to hold, especially there's something called kangaroo mother care, which is where the mother holds the baby skin to skin. This has shown to decrease mortality, other complications. Some literature says it helps with the breathing as well. It also helps mommy to bond with baby, and it helps with the milk production as well. So we try that as much as possible to get mommy and even daddy can hold baby.